If you're a man over 50 who masturbates, there's something important we need to discuss. Have you ever wondered whether this practice is truly beneficial for your health at this stage of life? Or perhaps worried privately that you might be causing some unseen damage? You're definitely not alone in having these concerns. This topic is shrouded in confusion, outdated beliefs, and a serious lack of reliable information. It represents one of the most common, yet rarely discussed worries for mature men. After examining the available research, it's clear why so much uncertainty exists around this subject. Studies reveal that while most men over 60 continue to engage in self-pleasure, many do so without understanding the real effects on their hormones, prostate health, or intimate relationships. That's exactly why we're having this honest, science-based discussion today. I'm going to share with you 10 remarkable benefits of masturbation in your mature years, followed by 10 crucial risks you must understand to ensure your practice remains healthy and beneficial. The remarkable benefits. Let's begin with the encouraging news. First, regular masturbation maintains penile health in ways you might not expect. The process of achieving an erection dramatically increases blood flow to the spongy tissues of the penis, called the corpora cavernosa. Think of this as physical therapy for your most intimate anatomy. This consistent exercise helps preserve tissue elasticity, which becomes increasingly important for achieving and maintaining firm erections as the years pass. Second, it actively promotes prostate health, and this is perhaps the most significant benefit. Multiple comprehensive studies, including groundbreaking research from Harvard University, have established a clear connection between higher ejaculation frequency and substantially reduced risk of developing prostate cancer. The prevailing theory suggests that regular ejaculation helps eliminate potentially harmful substances and secretions from the prostate ducts, essentially keeping this vital gland clean and healthy. Third, masturbation strengthens your pelvic floor muscles through the rhythmic contractions that occur during climax. These contractions engage critical muscles like the pubococcygeus muscle. A robust pelvic floor is essential for erectile function, ejaculatory control, and preventing urinary incontinence, which becomes an increasingly common concern for aging men. Fourth, it naturally reduces cortisol, your primary stress hormone. In our high-pressure modern world, this represents an incredible built-in advantage. Research demonstrates that orgasm triggers a significant decrease in cortisol levels. Lower cortisol helps regulate blood pressure and diminish anxiety, making masturbation a natural tool for both cardiovascular and mental wellness. Fifth, the practice releases a powerful combination of feel-good brain chemicals. Orgasm floods your brain with dopamine, the motivation and pleasure molecule, along with oxytocin, often referred to as the bonding hormone. This natural mood enhancement provides genuine feelings of well-being and emotional connection, which proves invaluable for maintaining mental health as you age. Sixth, regular self-pleasure aids in early detection of physical problems. This practice makes you intimately familiar with your own body, and this regular self-examination represents one of the most effective methods men have for discovering early signs of conditions like testicular cancer, penile fibrosis, or other abnormalities that might otherwise remain undetected until they become serious. Seventh, masturbation significantly improves sleep quality. Following orgasm, the release of hormones like oxytocin and prolactin, combined with reduced cortisol, creates a powerful sedative effect. This helps your body achieve deep relaxation, making it much easier to fall into restorative, quality sleep, something that often becomes more challenging with advancing age. Eighth, it enhances blood circulation throughout your entire pelvic region, not just the penis. This improved circulation benefits the health of your bladder, prostate, and surrounding muscles, preventing problems related to poor blood flow and stagnation that can develop over time. Ninth, masturbation serves as an excellent training method for ejaculatory control. For men who experience premature ejaculation, self-pleasure provides a safe, private environment to practice techniques like the stop-start method. This allows you to better understand your body's signals and develop greater control, skills that directly transfer to partnered intimacy. 10th, it keeps your sexual desire and neural pathways actively engaged. Your brain is your largest sex organ, and by regularly participating in sexual fantasy and physical stimulation, you maintain the neural circuits associated with desire and arousal. This helps preserve a healthy libido and sexual responsiveness, even during periods when you don't have a regular partner. The critical risks you must understand. However, to gain a complete understanding, we cannot focus solely on the positive aspects. A truly healthy practice requires conscious awareness, so let's examine the 10 potential risks and negative effects you need to monitor carefully. The first risk involves social isolation. This becomes problematic when self-pleasure transforms from being part of a healthy sexual life into a substitute for genuine human connection. The solution requires awareness, ensuring this practice complements your life rather than encouraging withdrawal from meaningful relationships. Second is the risk of developing skin micro-lesions. This typically occurs when masturbation is performed too aggressively or without sufficient lubrication. These microscopic tears can cause irritation and inflammation, potentially creating entry points for infection. The prevention is straightforward. Always be gentle and use quality water-based lubricant. Third, you risk desensitization. If you consistently stimulate yourself using identical technique, pressure, and rhythm every single time, your brain can become conditioned to respond only to that specific type of touch. This conditioning can make achieving arousal or orgasm with a partner significantly more difficult. The solution involves varying your technique, rhythm, and focus to maintain sensitivity. Fourth, frequent masturbation can mask underlying causes of erectile dysfunction. If you can achieve erections during self-pleasure but struggle with a partner, it might seem tempting to ignore this discrepancy. However, this pattern can hide serious underlying health conditions like cardiovascular disease, diabetes, or hormonal imbalances. If you notice this occurring, consulting with a healthcare professional becomes essential. Fifth is nerve compression from poor posture. Many men masturbate while sitting in uncomfortable chairs or hunched over, which can compress the pudendal nerve in the pelvis. Over extended periods, this compression can lead to genital numbness or chronic pelvic pain. The ideal approach involves practicing in relaxed, comfortable positions, such as lying down with proper support. Sixth, masturbation can become an unhealthy emotional escape mechanism. Using self-pleasure as your primary or only method for coping with stress, boredom, or frustration can create behavioral dependency. Maintaining emotional health requires developing a diverse range of coping strategies, including regular exercise, meditation, and meaningful social connections. Seventh involves persistent feelings of guilt and shame. Many men were raised with powerful cultural or religious taboos surrounding self-pleasure. If these feelings continue to cause distress, speaking with a sex-positive therapist or counselor can be tremendously beneficial for reframing this natural practice in a healthier psychological context. Eighth is pelvic congestion. While infrequent ejaculation increases risk for prostate problems, excessively frequent ejaculation, multiple times daily over extended periods, can sometimes create feelings of heaviness or aching in the testicles and pelvic area. The solution involves moderation and careful attention to your body's signals. Ninth involves potential impact on semen quality, though this only matters if you and a partner are actively trying to conceive. While masturbation doesn't harm long-term fertility, daily ejaculation can temporarily reduce sperm concentration. For optimal sperm quality, research suggests abstinence periods of 2 to 5 days work best. 10th is disconnection from reality, often linked to pornography use. If masturbation becomes heavily dependent on extreme or unrealistic pornographic content, it can distort your expectations and make connecting with real-life partners more difficult. Balance requires using visual aids alongside your own imagination and memories of authentic, intimate experiences. The bottom line: masturbation after 50 isn't simply good or bad, it's a tool. Like any tool, how you use it determines its ultimate effect on your life and health. The secret ingredient is always consciousness. When practiced with awareness, respect for your body, and appropriate moderation, it can serve as a powerful ally for maintaining your health and vitality throughout your mature years. The key lies in understanding both the benefits and risks, then making informed decisions about how this practice fits into your overall approach to health and wellness. Remember that every man's situation is unique, and what works best for one person may need adjustment for another. Most importantly, never hesitate to discuss these topics with qualified healthcare professionals. They can provide personalized guidance based on your specific health profile and circumstances. Your sexual health remains an important component of your overall well-being, regardless of your age, and deserves the same attention and care you give to other aspects of your health.